Medical use of marijuana has been a controversy by many people for years. The use of an illegal drug in some states for medical purposes is hard for some people to visualize the benefits. Over the past many decades, some states in the US have been driving towards legalizing marijuana for the purpose of medical use. The benefits of marijuana in many medical cases are often unclear to those who disagree with the intervention, especially when used in children. I chose this controversy because it really is a controversy in my everyday job as a nurse, which I'll go into more detail in later on. Dating all the way back to the 1970s, marijuana started to be legalized for medical use in some states. As of 2020, 20 states legalized the use of marijuana for medical use, and 15 states legalized marijuana for both medicinal and recreational use. That leaves 15 states that still consider the use of marijuana overall illegal. The two sides of the medical marijuana controversy are strictly right and left. The first side includes those in favor of the medicinal use of marijuana. This side tends to see the positive outcomes for individuals that have exercised all other options. The second side includes those that are unsure about this intervention. This hesitancy stems from the unknown of negative effects and the use in children. Medicinal marijuana is still fairly new, which raises questions among the population. I will dive deeper into each of these sides on the next few slides. In a study by Bradford and Bradford, reported evidence of positive outcomes from the use of medical marijuana dates back into 1980s. Marijuana has been known to help treat epilepsy, pain, nausea, glaucoma, arthritis, migraines, and so many more. Marijuana has the capability of binding to nerve receptors and neurotransmitter receptors in the body, which leads to relief of pain. With this action, marijuana is capable of relieving chronic pain that no other medication can treat. Individuals that experience chronic pain, whether it's from cancer or arthritis, only have medical marijuana as a treatment option to live a good quality life. In an article from 2014 by Edward Ma and Paige Fiji, a young 5-year-old girl named Charlotte was discussed, and Charlotte ranged from 50 seizures per day and up to 300 plus seizures per week. Charlotte has been on many anticonvulsants and antiepileptics, and nothing could stop the seizures. After starting medicinal marijuana, Charlotte went 7 days seizure-free and only averages 2 to 3 seizures per month. With the effect that marijuana has on Charlotte's body, she was able to be weaned off of her antiepileptic and anticonvulsant medications completely. At one point, doctors told Charlotte's family they had reached the end and there was nothing else they could really do for her. And not one doctor recommended marijuana as an option because of Charlotte's age, and yet it really did save her life. Although some patients like Charlotte may have positive outcomes with the use of medicinal marijuana, that effect may not be the same for another patient. One of the main concerns about medicinal marijuana is the use in children. There are many cases where it's used for adults for pain, nausea, seizures, but not many including children. The long-term effects on children are very unclear both neurologically and physically, as their brains aren't fully developed yet. Marijuana does have some noted side effects. These include alteration in decision-making, orientation, memory, and overall function. These side effects are what are typically found in adults and typically unknown in children. That is where the question arises: does marijuana alter children differently than adults? And what is that long-term effect? The second concern that is most common with the use of marijuana for medical treatment is the fear of addiction, tolerance, and dependency. Although the dosage that is given for medicinal use is often given at a therapeutic level, there is still that small chance for addiction. And children and adolescents are most vulnerable for this, and often the consequences are more severe. Yeah, this is scary for parents who are looking to give this to their children who may need to be treated, especially for nonverbal children that can't say when something doesn't feel right. In a study completed in Australia, the chance of addiction, dependency, and more severe adverse effects are resulted in the mentally ill, leaving no evidence of positive outcomes for those with depression, schizophrenia, and other mental illnesses. Personally, I see the logic behind both sides of this major controversy. I'm a registered nurse and I feel like I understand the feelings from each side. I see the positive outcomes and I see the fear of taking an illicit drug. My overall opinion on medicinal marijuana is that if it works, why not use it? I wouldn't say I'm a strong advocate, but I'm not against it either. As a pediatric home health nurse, I see a lot of children with epilepsy that have exhausted all options to help slow seizures. One family had tried over 10 different seizure medications, but the side effects of all of them were too harsh for the child to function, so they opted to try medical marijuana, which was the only therapy that stopped the seizure almost immediately and didn't produce those harsh side effects. In this situation, I think it's a no-brainer but to use the medical marijuana. It stopped the seizure and they didn't have the side effects. I would much rather have a child not suffering on marijuana than a child suffering with no medical option. Working as a nurse in Texas, I'm unable to administer medical marijuana. This part of the controversy is where I wish there was more research. I wish all states would legalize marijuana, so those that have tried all of their options have that one more option to try. I was recently just unable to rescue a patient from a seizure because the only treatment that worked was medical marijuana by a nasal spray, and I couldn't legally administer it. This seems corrupt to me. If a patient is prescribed medical marijuana by a physician, I should be able to administer it. One thing that I think is hypocritical of the offending side is when it comes to side effects. The neurological long-term effect of marijuana was discussed above, but the neurological effect of untreated seizures was not discussed. When discussing marijuana, everyone's quick to talk about all the side effects, when in reality, is there any medication that doesn't have possible side effects? I believe the side effects scare consumers because marijuana is an illicit drug, when really every single other drug has side effects. There are far more dangerous medications that produce deadly side effects over cannabis. The side effects experienced from medications differ from person to person, as does marijuana. This is why I believe the argument against marijuana due to side effects is not an irrelevant argument. There is still so much research that needs to be done about medicinal marijuana. As does any controversy, there will always be two sides. Personally, seeing the positive outcomes in front of my own two eyes has made my perspective more clear and I can understand the topic better. You just have to ask yourself, are the positives worth the negatives? Thanks for listening to my social and ethical controversy presentation.